Hello students, this video will discuss about nose or the nasal cavity. Now the nasal cavity or the nose are two different things. Nose is composed of the external nose and the nasal cavity. Now the nose is divided into two nasal cavities with a midline septum. So this is the external nose. We are seeing that it is having a bony part and a cartilaginous part. So this is the bony part which is composed of nasal bones. First is these are the nasal bones. Next we have the frontal process of maxilla, and the third bone is the nasal notch of the frontal bone. So the bony part is composed of nasal bones, frontal process of maxilla and nasal notch of the frontal bone. Of the cartilages, which is the lower part of the external nose, the cartilages are the septal cartilage, the upper lateral nasal cartilage, the lower lateral nasal cartilage and the alar cartilage. So we have four cartilages: septal cartilage, upper lateral nasal cartilage, lower lateral nasal cartilage and alar cartilage. So this is the external nose, the bony part and the cartilaginous part. So before we move on to the other parts of the nose and the nasal cavity in this video, we should know, since this video will help you to pass your first professional MBBS exam, we should also know that what are the must know areas of nose. So here this external nose composition is a nice to know area where we should know the bony and the cartilaginous part. But what we must know here is number one, the nasal septum, its formation, its nerve supply, its blood supply, and the nasal cavity, which is the lateral wall of the nasal cavity specifically, because medial wall is actually the nasal septum. And there also we need to know the important features of the lateral wall of the nasal cavity, the nerve supply and the blood supply. So moving on, we will first see the nasal septum or the medial wall of the nasal cavity. But before we go for the nasal cavity, medial wall, we will just have a small look about the roof and the floor. Obviously, a cavity is there which is formed of roof, floor, medial wall and lateral wall. So first, this is the roof. This entire part is the roof of the nasal cavity. Now, the roof of the nasal cavity is made up of, anteriorly, we have the nasal and the frontal bones. Anteriorly, we have the nasal and the frontal bones. The horizontal or the intermediate area is made up of the cribriform plate of ethmoid bone. It is made up of cribriform plate of ethmoid bone. And the posterior part is made up of the body of the sphenoid bone. The body of the sphenoid bone. So the roof is made up of the nasal part of the nasal and the frontal bones. That is the nasal notch of the frontal bone and the nasal bones. For the middle horizontal part or the intermediate part, we have the cribriform plate of the ethmoid, and for the posterior part, we have got the body of sphenoid. If we come to the floor, now if we go to the floor is formed by, anteriorly by the palatine process of the maxilla, and posteriorly we have the horizontal plates of the palatine bones. So before that, we will see this picture once again to make this more clear. So this is the floor. This is the anterior part. This is the posterior part. So this pink one is the palatine process of maxilla. This is the palatine process of maxilla. And the floor posteriorly is formed by the perpendicular plate of the palatine bone. It's formed by the perpendicular plate of the palatine bone. So we have done the roof and the floor. We have done the roof and the floor. Now we come to the medial wall of the nasal cavity, which is otherwise known as nasal septum. Now, if you see the nasal septum over here, you can see this is a very nice diagram, a 3D representation of the nasal septum. Now, this nasal septum is formed of two bones, main and one big cartilage, right? So, these two bones are the principal bones which are forming the nasal septum, and this is the principal cartilage which is forming the nasal septum. So, what are the two principal bones forming the nasal septum? Number one, the perpendicular plate of ethmoid, which is above and anterior. Above and anteriorly, we have the perpendicular plate of ethmoid bone, and below is the vomer bone. Below and posteriorly. Below and posteriorly, we have the vomer bone. Below and posteriorly, we have the vomer bone. So, above and anteriorly, we have the perpendicular plate of ethmoid. Below and posteriorly, we have the vomer bone. There is the quadrangular cartilage, which is anterior and inferior, So, these are the principal parts which are forming the medial wall of the nasal cavity or the nasal septum. So, the nasal septum, if we have to write the answer, we have to write it in this flowchart form. The nasal septum composed of a bony part and a cartilaginous part. The bony part again is formed of some principal bones and some accessory bones. So, what are the principal bones? The principal bones is anterosuperior and posterior-inferior. As I said, it will be above and in front and below and behind. So, anterosuperiorly we have the perpendicular plate of the ethmoid. Posterior-inferiorly we have the vomer. Of the accessory bones, above and in front, obviously we have the nasal spine of the frontal bone and the nasal bone. Nasal spine of the frontal bone and the nasal bone. Above and behind we have the sphenoidal crest and the rostrum. We have the sphenoidal crest and the rostrum. And below we have the nasal crest formed by the palatine process of the maxilla and the perpendicular plates of the palatine bone. So, this is the bony part. So, if we refer to our this diagram, then this is the perpendicular plate of ethmoid, which is anterosuperior. This is the vomer, which is posterior-inferior, right? Then anteriorly we have the nasal bone and the nasal notch of the frontal bone. Posteriorly we have the sphenoidal rostrum and inferiorly we have the palate, the palatine process of the maxilla and the perpendicular plate of the palatine bone. Perpendicular plate of the palatine bone. These two form a nasal crest which comes in inferior articulation with the vomer. Okay. So, this is the bony configuration of the nasal septum. Now, if we come to the cartilaginous configuration of the nasal septum, you can see this is the septal cartilage. This is the septal cartilage. So this septal cartilage has articulation with different bones and cartilages. So if we see that the cartilaginous part which is placed antero-inferiorly in the nasal septum, it actually consists of mainly two cartilages. One is the septal cartilage, one is the septal processes of the lower nasal cartilage. There is the upper lateral nasal cartilage and lower lateral nasal cartilage, of which the lower lateral nasal cartilage, they have some septal processes. So these septal processes will also come in articulation or in formation of the medial wall of the nasal cavity, otherwise known as the nasal septum. So this is the septal cartilage and this is the septal process of the lower nasal cartilage. So we will see this is the septal cartilage. So septal cartilage is upper. Articulation is the posterior-superior margin is articulating with the perpendicular plate of ethmoid. The posterior-superior margin is articulating with the perpendicular plate of ethmoid. Now we come to the this is the posterior-inferior margin. This is the posterior-inferior margin articulating with the vomer. The posterior-inferior margin is articulating with the vomer. So I again repeat, this is the septal cartilage. This is the septal cartilage where the this is the posterior, this is the anterior-superior, this is the anterior-inferior, this is the posterior-superior, this is the posterior-inferior. So the posterior-superior margin obviously articulating with the perpendicular plate of ethmoid, posterior-inferior margin articulating with the vomer. Okay. Now the anterior-inferior margin is the articulating with the upper lateral nasal cartilage of the other side, and the anterior-inferior margin is articulating with the lower nasal cartilage. Now this is the entire formation of the nasal septum. This is the entire formation of the nasal septum. Formation, bones forming nasal septum, cartilage forming nasal septum. Also it comes in your MCQ also, the bones forming nasal septum. Also, which is very important that you should also know, this comes as a 10 marks question or previously a 7 mark question. Bones forming nasal septum and then the cartilages. Now we come to the arterial supply of the nasal septum. Arterial supply of the nasal septum. Now here we see, before I go to the writing part, now here you see we can divide the entire nasal septum into 4 quadrants. This is antero-superior, this is posterior-superior, this is antero-inferior, this is posterior-inferior. So what we can see here, that there is the internal carotid artery which is giving a branch known as the ophthalmic artery. The ophthalmic artery is having 2 branches. Number 1, the anterior ethmoidal. Number 2 is the posterior ethmoidal. So anterior ethmoidal artery is the sole supply of the antero-superior quadrant of the nasal septum, whereas the posterior ethmoidal artery is one of the supply of the posterior-superior quadrant of the nasal septum. Next, we have the posterior-inferior part. The posterior-inferior part, again we have the external carotid artery. The external carotid artery will be giving the maxillary artery. One of the branches of the maxillary artery is the sphenopalatine artery. This sphenopalatine artery will be supplying the posterior-superior part of the nasal septum. Also, it will give some branches to the posterior-inferior part. Again, this maxillary artery, another branch is the greater palatine artery, which is supplying the antero-inferior part. So, sphenopalatine artery supplying the posterior-inferior part, branch of external carotid, because it's a sub-branch of maxillary. Greater palatine artery, which is supplying the antero-inferior part, branch of external carotid, sub-branch of the maxillary, and above antero-inferior and posterior-inferior will be branches of ophthalmic artery, that is anterior ethmoidal and posterior ethmoidal, supplying anteroinferior part, anterosuperior part and posterosuperior part. So the anterosuperior part and the posterior superior part is supplied by the anterior ethmoidal and posterior ethmoidal artery respectively, which are branches of the ophthalmic artery, branch of internal carotid artery. Now this particular arrangement is very important in case of nasal septum, that is both supplied by internal and external carotid artery. So here just we'll see that this is the anterosuperior quadrant supplied by the anterior ethmoidal branch of the ophthalmic. The posterior superior part is supplied by the posterior ethmoidal nerve. The antero inferior part we known as the Little's area. We will come to the Little's area. This is the septal part. And the posterior inferior part is supplied by the greater palatine branch of the maxillary artery and sphenopalatine branch of the maxillary artery. The mobile part of the nasal septum is supplied by the facial artery. The anteroinferior part of the nasal septum is supplied by anastomosis of few arteries, which is known as the Little's area. Now we will see the Little's area now. So this is the Little's area, which is the anteroinferior part of the nasal septum. So this Little's area is the place in the nasal septum where there is anastomosis between the anterior ethmoidal arteries, branch of internal carotid artery. Septal branch of the superior labial artery, branch of facial artery, branch of external carotid artery. Next, we have the posterior ethmoidal arteries, which is branch of internal carotid artery. And the branch of sphenopalatine artery, which is the branch of maxillary artery, which is again the branch of external carotid artery. So Little's area is the place where there is anastomosis between the branches of the internal carotid artery and the external carotid artery, which is present in the anterior-inferior part of the nasal septum. The anastomosis is between the anterior and the posterior ethmoidal arteries, branch of the ophthalmic artery, branch of internal carotid artery, which is supplying the superior part of the nasal septum. The posterior inferior and the anteroinferior part of the nasal septum is supplied by the facial artery and the sphenopalatine artery. The posterior inferior part supplied by the sphenopalatine artery, which is the branch of the maxillary artery, branch of external carotid artery, and the anteroinferior part is supplied, or the mobile part is supplied by the superior labial artery, branch of facial artery, branch of external carotid artery. So this is an area which is highly vascular and it is a site of arterial anastomosis between ICA, that is the internal carotid artery, and external carotid artery. So if by trauma like nose picking or by small ulcers, this area is, if it gets affected, there is profuse bleeding. So Little's area is a site of profuse bleeding if there is any trauma. The venous drainage of the nasal septum will be accordingly to the arterial supply. Now we come to the nerve supply of the nasal septum. The nerve supply of the nasal septum again we divide it into four quadrants. So here in the anterior part we have the external nasal nerve. So we have the external nasal nerve supplying the anterior part, and then in the superior part of the nasal septum it is the anterior ethmoidal nerve and the posterior ethmoidal branch. So we start off with the venous drainage of the medial wall of nasal cavity, which is known as nasal septum. Now here we see that this is the nasal septum, where again we divide it into 4 quadrants. In the anterosuperior quadrant, the venous drainage is done by superior ophthalmic vein. The posterior superior quadrant, the venous drainage is by the pterygoid venous plexus. Though we call it the posterior superior quadrant, it is almost entirely the posterior superior and the posterior inferior quadrant also. For the mobile part, it is the facial vein and which drains into the internal jugular vein. So now we come to the nerve supply of nasal septum. The nerve supply of nasal septum can be divided crossly into special sense of olfaction and general senses. For the special sense of olfaction, it is the olfactory nerves which is carrying the sensations, and these are directly going through the cribriform plate of the ethmoid to the cranial cavity. Next, for the general senses, we have both the nerves, that is mainly the trigeminal, the ophthalmic division and the maxillary division. Ophthalmic division and the maxillary division. Now here we see the nerve supply. Again, the nerve supply is divided into grossly 4 quadrants. So first of all, we see this is the olfactory nerves. These pass through the cribriform plate of ethmoid and they go to the cranial cavity. For the anterosuperior quadrant, we have the very important anterior ethmoidal nerve, which is the anterosuperior quadrant supplier, and it is the part of the ophthalmic division of the trigeminal nerve. The anteroinferior quadrant and the mobile part of the nasal septum is supplied by the external nasal nerve, which is again the part of the ophthalmic division. The part of the nasal septum, which is again the the part of the nasal septum, which is the floor, is supplied by the anterosuperior alveolar nerve. It is supplied by the anterosuperior alveolar nerve. Next, we come to the intermediate part. The intermediate part is supplied by the long sphenopalatine nerve. Long sphenopalatine nerve. And the posterior inferior part or the posterior part, it is supplied by the greater palatine nerve, the sphenopalatine nerve and nerve of the pterygoid canal, which are branches of the maxillary division of the trigeminal nerve. So, olfactory nerve is carrying the special sensation. The anterosuperior part by the anterior ethmoidal nerve, branch of ophthalmic. The mobile part by the external nasal nerve, branch of ophthalmic. Floor by the anterosuperior alveolar nerve by the maxillary division. Again, the intermediate part by the long sphenopalatine nerve, the intermediate part by the long sphenopalatine nerve, which is the maxillary part, and the posterior part by the greater palatine, sphenopalatine and nerve of the pterygoid canal, which is a part of the maxillary division. Now we come to the lateral wall of nasal cavity. The lateral wall of nasal cavity, as we see here, it is mainly characterized by the turbinates. Now, what are the bones contributing to the lateral wall of the nasal cavity? First of all, it is the nasal bone. Next, we have the lacrimal bone. Next, we have the superior and the middle concha of the ethmoid. And lastly, we have the inferior nasal concha. The floor is formed by the perpendicular plate of the ethmoid bone. Also, the medial pterygoid plate of sphenoid gives a bit of contribution. So now we come to the features. So on the lateral wall, we have this concha where the middle and the superior concha are the parts of the ethmoid, and the inferior concha is a separate bone. Now these concha, when covered by mucous membrane, these are known as turbinates. These are the turbinates which characterize the lateral wall of the nasal cavity, and each turbinate under its cover, it contains a meatus. This meatus is having the opening of the paranasal sinuses. So each meatus is having the opening of different paranasal sinuses. Okay. So first of all, we will see how many meatus are there. There are 4 meati, namely inferior, middle, superior and supreme. These are under the cover, the inferior meatus under the cover of inferior concha or inferior turbinate, middle meatus under the cover of the middle turbinate, and superior meatus under the cover of the superior turbinate. The supreme meatus is just above the superior meatus. Now, the different paranasal sinuses, they open into these meatus. Let's see how. The inferior meatus has the opening of the nasolacrimal duct. The middle meatus, it has a swelling which is known as bulla. The bulla has the opening of the middle ethmoidal air sinuses. Then we come to the floor of the hiatus semilunaris. What is hiatus semilunaris? There is a slit-like gap just between the bulla and the floor of the middle meatus. So there is a slit-like gap below the bulla ethmoidalis, and floor of that gap, which is the floor of the hiatus, will be having the opening of the maxillary air sinus. The anterior part of the hiatus semilunaris will be having the opening of the anterior ethmoidal air sinuses. And the tip of the hiatus semilunaris will be having the opening of the frontal sinus through frontonasal duct. This hiatus semilunaris, where the frontonasal duct is opening, is known as infundibulum. Okay. Superior meatus, it is the posterior ethmoidal air sinuses which are draining, and in the supreme meatus, the sphenoidal air sinuses. So this particular slide is very, very important, and this often comes as your short note, as your short long answer, even as your long answer. It's a part of your long answer. So now we again come to the blood supply of the lateral wall of the nasal cavity, and here we divide it into 4 quadrants: anterosuperior, posterior superior, anteroinferior and posterior inferior. The anterosuperior by the anterior ethmoidal artery, branch of ophthalmic artery, branch of internal carotid. The posterior superior is by the sphenopalatine artery, branch of maxillary artery, which is a terminal branch of the external carotid artery. Next, in the posterior inferior part, we have the greater palatine artery, which is again a branch of the maxillary, branch of the external carotid. And the anteroinferior or the mobile part is supplied by the facial artery and the greater palatine artery, which is again the branch of the external carotid artery. So we see 1 quadrant is done by the internal carotid, other 3 quadrants are supplied by the external carotid artery. For the nerve supply of the lateral wall of the nasal cavity, the special senses carried by the olfactory nerves, general senses carried by the ophthalmic and the maxillary division of the trigeminal nerve. The secretomotor fibers from the nasal glands are supplied or are carried by the pterygopalatine ganglion branches, and the sympathetic supply is by the preganglionic lateral horn cells of the T1 and T4 segments. The postganglionic will be the superior cervical ganglion. So the preganglionic fibers will be arising from the T1 to T4 lateral horn cells of the spinal cord. Postganglionic branches will be from the superior cervical ganglion. Again, if we come to the nerve supply, the anterior ethmoidal nerve, it is supplied. So now we come to the nerve supply. The nerve supply again is divided into four quadrants. In the anterosuperior, it is anterior ethmoidal nerve, branch of ophthalmic. Posterosuperior, the posterolateral branches of the pterygopalatine ganglion, which is branch of maxillary. In the posterior-inferior, it is the anterior palatine branches of the pterygopalatine ganglion, which is maxillary. And in the antero-inferior quadrant, it is the antero-superior alveolar nerve, again branch of maxillary. So this finishes off the lecture on the nose. Nose itself is a very, very important topic, and this important topic is both for theory and practical. Theory, every sort of question may come from it, and the most importantly is this nose is also important for your practical head and neck sagittal section. Hope you like this video, and this video helps you to answer your questions in your first professional MBBS. Thank you.